Hand hygiene for 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, hello. I'm your nurse, Nurse Johnson, and I'm just here to do a quick checkup on you, alright? And I also noticed that you have a trach in your throat, and that's probably gonna make it a little hard for you to speak. So to make it easier, we're just gonna do this, alright? Thumbs up for yes and a thumbs down for no, okay? Thumbs up? Okay, perfect. And before I begin, is your name John Smith, born July 5th, 1950? Thumbs up? Okay, perfect. And I also noticed you didn't have an allergy band on you. And are there any allergies I should be made aware of? Maybe towards like tape or chlorhexidine? No? Okay, perfect. Well, we took a set of vitals from you earlier today and everything was normal, but it looks like this time your oxygen is a little low. It's at 85%. And before I do anything, do you have any pain right now? No? Are you experiencing any shortness of breath? No? Okay. Well, it looks like you're working to breathe a little bit. Let me just use my stethoscope to listen, and when I do, just take a deep breath in for me and breathe out, okay? I don't have a stethoscope, but this is what I would do. Breathe in, breathe out, breathe in, breathe out, okay. Well, it looks like there has been some secretions built up in your airways, but we could get rid of that relatively quickly. That's probably also why your oxygen levels are a little low. So what I'll do is I'll get in there and suction it out. Then after I'm done with that, I'm going to go ahead and change the dressing, clean you up a bit. I'm going to change the inner cannula. It's the little thing that's in your throat. And also I'm going to change your necktie for you, okay? Thumbs up? Okay, perfect. And before we do you have any questions or concerns? No? Okay. Well, it should be a painless procedure and it should take maybe around 10 minutes. So let me just check my supplies real quick, alright? I have 1 extra inner cannula and 2 extra trachs, 1 of smaller size, just in case we need it. The suction catheter is connected to the suction canister running at 120, but it is an old one which I will have to replace. The ambu bag is connected to the oxygen running at max flow rate. My ambu bag is working, okay, perfect. And the oxygen collar is connected to the humidifier. Perfect, okay, I'm actually gonna go ahead and lift up your head a bit. I'm gonna adjust the bed to semi-Fowlers and then close the curtain for some privacy. Okay. Give me 1 second, alright? Hand hygiene for 20 seconds. Go ahead and clean the table for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Hand hygiene for 20 seconds. Okay, I'm just gonna go ahead and get my supplies. How are we feeling so far? Comfortable? Okay, well, like I said, it should be a painless procedure, and it should be done relatively quickly. Okay. Table has dried for 2 minutes. Placing the sterile field, ensuring the plastic side is on the patient with the paper side going up. There it goes out. Cannula. And the cannula coming in from the side. Replacing the canister or the suction catheter. Checking, double checking for suction at 120. Perfect. Okay. And sterile water coming in from the side. Perfect. Okay. Hand hygiene for 20 seconds. Okay. So what I'm going to do now is actually I'm going to give your body a little extra oxygen to work with. Double check and see if it works. Your oxygen levels are still at 85%, so this is just going to give your body a little bit more oxygen to work with, okay? Just breathe normally for me. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. Okay, looks like your oxygen levels went up to 97%, which is perfect. This is also where I would check to see if his oxygen levels are at good levels. If they're not, I would keep going with the breathing until it is. Okay, I'm just gonna go test my suction out real quick. Suctioning, slurp, slurp, slurp. Perfect, looks like it works. Okay, so this will only take 10 seconds. You might feel a little discomfort, but you should feel no pain, all right? 1 second. Going in for 3 seconds, pulling out for 7. 1, 2, 3. Patient has cough, 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 pulling out for 7. 1, 2, 3, 4, 5, 6, 7. Okay, perfect. Looks like there are also some secretions collected. This is also here where I check for any need to resuction. If there was, I would wait a minimum of another 30 seconds before doing it again. Okay, and how'd that go for you? Good. Well, it looks like your oxygen levels are stabilizing at 97%, which is exactly what we want. 20 seconds of hand hygiene. And so now I'll just be replacing that trach of yours, or not the trach, the cannula. And then I'll clean you right up and we should be good. All right, 1 second, all right? Grabbing the extra trach, making sure to only touch the tip. Going in and making sure it clicks on. And taking out the gauze. Okay. I'm actually going to go ahead and prep my supplies now, alright? Give me 1 second. Stuff is prepared. Okay. I'm gonna go ahead and assess this site real quick. Wet cotton swab, checking the site for any infections or signs of redness. Nope. Okay, good. Okay. Once underneath. Once on top. Okay. One wet gauze. Second wet gauze. Going from the top. Okay. And the final wet gauze to clean the stabilizer. Okay. Patting dry. Pat, pat, pat. And split gauze. Okay. Okay. Go ahead and reoption. Okay. Looks like everything went well. Okay. So actually, I'm gonna have to go and get another nurse to help me with this. I actually can't replace your necktie by myself, so I'm gonna be back in like 5 minutes to get another nurse. But before I leave, how would you say that went? Good? No pain? Comfortable? Okay, perfect. Okay, well, your call button's right here. Now I'm just gonna go ahead and lower you to the lowest position. Okay, and I'll be right back with another nurse, okay? Alright, hang tight, alright? Hand hygiene for 20 seconds. Patient is at low. Oxygen's at 97. Okay. I'll be right back. Both nurses come in wearing a face mask and face shield. Both nurses does 20 seconds of hygiene, and both nurses don gloves. Okay, hello, Mr. Smith. Now, before I start, let me just verify your identification. You John Smith, born on July 4th, 1950? Yes? Okay, thank you. Okay, perfect. Scan and still no changes in allergies. All right, good. All right, looks like your vital signs are still doing good, which is great. This is actually the second nurse, and they'll be here to help me change out your dressing, okay? So I'm just gonna move you to semi-fellows for a bit. Okay. So the second nurse would be on the left side. Okay. I'm gonna remove your oxygen collar, all right? Okay. So the nurse would be on the second side, holding down. The second nurse holds down the faceplate while I unbuckle, pushing down into the pillow and underneath the patient and checking for pressure sores. Oh, looks like you don't have any pressure sores on your neck. That's good. That's a good sign. Okay. While the second nurse is still holding onto the faceplate, I start to fasten the second trach tie. Okay. So fasten, and then second nurse still holding onto the faceplate while I push this down into the pillow and over on the other side. So you have no pressure sores here, which is good. I hold down the faceplate while the second nurse unfastens the original trach tie. Okay. And I'll discard of it. Second nurse will know if there are any pressure sores on the left side. I will hold on to the faceplate while the second nurse goes in and under. Okay, good. All right, perfect. All right, second nurse notes that there are no pressure sores on the left side. Take 2 fingers and check. Other nurse will check as well. Is that comfortable, Mr. Smith? Yeah, okay. Is there any pain at all? No, it looks like your vitals are still good. Let me clean you up real quick. Let me get rid of this sterile fluid. I'm gonna go ahead and listen to your lungs, all right? Okay. So same as last time, just breathe in and breathe out once my stethoscope's over. Breathe in and breathe in and out. Okay. So lung sounds are clear and bilateral, which is good. Your O2 stats are fine, which is reflected by the lung sound. So it looks like everything has been cleared up. Any pain? You feeling any pain right now? No? Okay, well, thank you so much for cooperating with us. And thank you for the second nurse for helping me with the trach tie. And now I just clean up. Okay. Get rid of the sterile field along with everything else. Toss these. And then leave a fresh mill catheter on this side while tossing out the old suction catheter for the next nurse to use. Okay, I'm gonna lay you back down flat, okay? Lay you back down flat. Okay, so any further questions before I leave? No? Okay, your call button's on the right, alright? And you're comfortable, correct? Alright, thumbs up. Okay, perfect. Okay, so before I leave, I'll make sure to document the date and time, the site assessment, as well as the pressure sore or the absence of pressure sores on his neck, if the patient tolerated the procedure, vital signs, especially the O2 stat, the sputum color from the canister, as well as the amount, and the respiratory assessment. Okay, both nurses will remove gloves and do hand hygiene for 20 seconds before leaving.